Welcome back. Quidel was given an emergency use authorization for its COVID-19 antigen test, which can be done at home, giving Americans another testing option. We have Quidel CEO Doug Bryant here with us, along with our health reporter, Anjalee Khemlani. So, Doug, the test, I've taken it before, these COVID tests, they cause a little bit of discomfort. How do you make sure that, the testing results are accurate, especially if people don't put it in far enough or do it correctly at home?
Yeah, the key difference here is that with this particular technology, ours and the product from Abbott Labs, the nasal swab is simply on the anterior nares. In other words, we don't have that long swab that you're thinking about that goes all the way to the nasopharynx, and it is quite uncomfortable. And I would say that, athletes that are routinely tested by PCR will tell you it's not very comfortable. Instead, these are very simple, easy swabs to take. It's very easy to actually get a reasonably adequate sample. So that's part of the reason that these tests have been successful and will continue to be successful, because it's a simple nasal swab. So any adult can do it easily, and any child can be swabbed as well under, with the help of a parent or caregiver.
Doug, what's the cost of the test, and where can people find it?
Well, we believe that in a 2-pack format, which would handle what you need during any given week, that it's likely at the retail level to be under $30 for both tests. In other words, each test would be at $15 or less. We've tested that out with marketing. Most of the retail segment that we've talked to, have suggested that that's where they would like to land, and therefore we're pricing our product obviously lower than that in order to fit within their scheme. We will be launching the product initially in the state of Arizona. We'll be making some announcements on that, but our thought initially is to do on-site testing for employers where they want to do this on-site, but also make it available to be taken home. We also think that there's a retail segment, and based on our market surveys, there seems to be quite a bit of interest on the part of folks throughout the country to routinely test themselves in order to make sure that they can, go to school, go to work, go to the grocery store, go visit, my mom, who's north of 80 years of age, and we can do that safely. And on the other hand, if I test positively, I'll stay at home and I'll call my physician. So I'll test twice a week. Day 1 and then day 2 would be at least 24 to 36 hours later. Provided those tests are negative, I'm free to move about. If they're positive, either one of them is positive, I stay home and call my physician and figure it out from there.
Doug, Anjalee here. So it sounds like you're targeting the employer base first in offices and then moving into the retail space. What is your production level at right now in order to meet that demand?
Well, to be clear, we're trying to address both. The issue for on-site testing is in that format, we can make significantly more tests. So we can make, millions and millions of tests per week. If we're putting these product in a 2-pack format, the difficulty in packaging and pouching the actual strip itself reduces that volume. So I see it more as a combination of both, and we'll do whatever we can, given that we're scaling up pretty dramatically over the next weeks and months.
Talk to me a little bit more about that. I noticed that in the statement that you released, you were talking about building out a new facility and targeting the second half of 2021. When can we actually expect this test in stores?
We'll launch into certain geographies and stores in the month of April. So we will have product out there. It won't be widespread throughout the United States, though. We simply don't have the capacity yet to do that. From the next couple of months, April and then June, there are stair-step events that increase pretty dramatically our capacity. And for the product that was just cleared, we expect to be doing somewhere around 50 million tests per month.
Doug, I know that you recently entered a partnership with the National Institutes of Health for a community-based initiative with this antigen test. Can you tell us what you're doing exactly and what kind of data you hope to glean from that?
Well, it's a partnership between the CDC, the NIH, and us. We are providing the product, of course. We're providing up to 2 million tests at no charge. And we will be distributing those products to a couple different areas in Tennessee and North Carolina. I believe it's 160,000 families who will be testing themselves three times a week. And what we hope is that we can demonstrate that by doing these serial tests each week, that we can dramatically reduce the amount of infection and prevalence in those communities.
Doug, I wonder about the pricing. I know you said that it was going to be under 30, but we know that there was a lot of discussion when Ellume, for example, was authorized, and their price point is about 30, and their idea was to lower over time as production scaled up. Do you also see a similar strategy in the rollout, or do you anticipate any reduction beyond that into, say, the single-digit dollars?
That's a very good question, and the short answer is, first of all, that for the $30 that we're talking about, that's 2 tests. So we're not at that $30 per test level. We're already down to something around $15. From a cost perspective, our factory absorption, obviously per test, will dramatically lower. Our own costs will be obviously in total lower, and therefore we should be able to lower the product cost down into, certainly sub 10.
All right, Doug, we've been chatting a lot throughout this program about travel and how more and more folks are ready to leave their homes, get on a plane. A lot of places like Hawaii, for example, do require negative tests before you can enter into the state. This is also true for other countries. Is there opportunities there as you see it? I know you said that there's a 24 to 36 hour window, which I think fits very nicely into some of those windows that most countries and states are giving some of those passengers. Are folks going to be able to use a test like yours to get approved to enter into another country or state?
We believe so. It's pretty clear that there's a great deal of interest by entertainment and travel industries to make sure that passengers or patrons feel safe. Certainly this is a way to accomplish that. I think the emerging data suggests that by testing at least twice per week, that we can safely move about, getting on airplanes, traveling to various locations. So I would expect that we will see more of that. I think initially a lot of places, including my own company, we were testing only weekly. Now we're doing it twice a week because the data tell us that by doing that, we can dramatically reduce the chances of folks coming in here to our place of business who might be infected. So we tested probably from the fall until even today, this week. We did find positives early on, and I think we've stabilized that. We've had a couple of weeks now where we haven't had any employees test positive. But in the event that somebody is infected, they're going to discover it, and obviously they'll take what measures they need to consult with their physician and clearly not show up at work. So I do think that there is an opportunity. We do have customers ex-US at airports where testing is done. We've been in numerous conversations here in the US as well.
All right, Quidel CEO Doug Bryant, health reporter Anjalee Khemlani, thank you both for this conversation today.